I want to focus on one way out of this, or something that may ease people's worries, and an interesting development in Scotland, where the most vulnerable Scots are going to be given free vitamin D supplements to help boost their immune system. People who have been shielding are to be sent a 4-month supply to compensate for a lack of natural sunlight. That comes as research suggests that people who suffer the most from coronavirus are almost twice as likely to be deficient in vitamin D, implying that supplements might help to protect against the disease. Let's speak to Rupa Huck, Labour MP for Ealing Central and Acton. She has met with England's Health Secretary Matt Hancock to talk about the benefits of vitamin D supplements. Thank you for coming on the programme tonight, Rupa Huck.
Hi, thanks for having me.
What is your understanding of what vitamin D can do in helping to fight COVID?
Well, look, it's not a vaccine, but then there's no vaccine in sight. It's a good preventative measure. So all vitamins are good for the immune system anyway. And for years, vitamin D has been known to be good for things like bones and muscles. But more recently, there's a whole slew of studies that show that it's good for respiratory tract infections as well. And there's been a randomised control from Spain in Cordova University particularly that shows that they gave it to people who had COVID, and half of them then didn't need ICU beds after that. So it can lessen the impact if you have got it, or it can stave it off. It can stop you getting it in the first place.
There was a French study that suggested that elderly people who had not taken vitamin D had an 89% increased risk of dying from coronavirus. Are you content that the science is settled on this issue?
Well, look, we know it's not bad for you. And as I say, there's no vaccine in sight. These lockdowns and tiered systems don't seem to be doing a lot. So it seems that there's literally nothing to lose from it. And apparently it's very difficult to overdose on it as well. So, I met with Matt Hancock. David Davis and I both went in to see him because I've been making the point. I kept asking questions about it in Parliament, and Hancock kept saying there's no connection between the two. And then in the end, exasperatedly, he said, you can come and see me and bring anyone else you like. There's no connection. But then we managed to sort of blind him with science. And he kind of said, and he said this to me in the House as well, that he'll put it in the messaging. Because, things like hand, space, some of these messages are getting a bit mysterious. It's like scissors, paper, stone. Whereas if you gave people something practical they could do. But I've not yet seen that new advertising that he was promising. And it looks like Nicola Sturgeon's beaten him to it again.
It's interesting what the Scottish Government are doing. They seem to be, if this is going to happen in England, slightly further ahead. What do you understand to be the position of the senior scientists advising the government about this? Are they looking at vitamin D studies?
Well, again, I asked him, when I first asked him, he said, I've conducted a trial, there's no connection. We found out that this trial was actually a secondary evidence review by NICE. But just this stuff is changing every day. By the day, literally, there are new studies. There's one coming out from Queen Mary College. And I think he was saying that sometimes the clinicians who advise him are a bit reluctant. But that's because they were trained, 20, 30 years ago when this stuff wasn't known. So it's an evolving thing. And we know, I first became aware of it when I did a lot of interviews around the time of the Public Health England report on BME deaths being disproportionate, because it was known to be a factor in there. Because if you've got darker skin, it kind of acts with the motion of sunlight on the skin. So again, people in lockdown, I think that's why Scotland's saying they're giving it, because it's a bit of a dingy place and a lot of people are indoors for 4 months. However, if you scratch beneath the... So if you've got darker skin, it doesn't react as quickly. If you're wearing sunblock, it doesn't work either, apparently. But if you scratch beneath the surface, everyone in this country is deficient in it. And especially now, it's sort of pitch black by 5 o'clock.
Quite, isn't it?
So
Grim.
now is the time.
Well, let me. It's really interesting that I wonder whether it is going to receive a bit of a boost, as it were, from some of your parliamentary colleagues to try and get the government to move on it a bit more. I must just pick up on something you said a little earlier, that you don't think these lockdowns, these tiers are working, that they're not doing anything. Why would Labour's national circuit breaker be any different?
Well, sorry, the tiered system, I think, to be honest, we've moved in London from tier 1 to 2. I don't think it's made a lot of difference. Whereas I think if you did something very dramatic, and also we need to sort out our test, track and isolate strategy, because that's proved to be very ineffective.
How would you come out of it? How would you come out of this national circuit breaker? Labour's saying 2, possibly 3 weeks. The last one went for...
Yeah, we missed a trick. It's half term this week. I mean, a lot of parents have trouble getting childcare on that week. They need it.
Yeah.
We could have done it that week. We're actually on parliamentary recess, it happens. But anyway, if you did that plus a week more, and if you had compensation for businesses.
But there's no guarantee that the virus will come down in those 2 weeks sufficient enough to open up again.
But you know, in places where they have done it, so South Korea, Taiwan, China, they've all got their cases have virtually disappeared. So I think it's worth a try, because at the moment cases are exponentially rising. So I think a dramatic intervention like that, and at the same time sort out the test track and isolate, compensate businesses. Again, I kind of think nothing to lose really if you compensated businesses properly.
Yeah, there's a lot of money at stake. But Rupa Huck, thank you very much indeed for your time tonight. Labour MP for Ealing Central and Axon, giving us an insight into her meetings with the Health Secretary around this issue of vitamin D.